Hi everyone, Gilliam Elliott here. Today we're going to talk about something that's really important and that could make or break your medical tourism company, and that's your medical tourism contracts. Now, you want to make sure that you don't coordinate, plan, or organize any trips for medical tourism clients until you have your contracts in place. So you want to make sure you have a contract in place with both the hospital as well as the patient. But there's a host of contracts you're going to need. There's a lot of contracts you're going to need. But today I want to focus on hospital contracts and your relationship with the overseas healthcare provider. So before we jump into what the contract is going to cover, let's talk about finding partners. So before you partner with a hospital, you want to make sure you vet them. And the best way to vet them and make sure that they're a good, credible, and reliable partner is by doing a site visit. So this is where you tour the hospital, you meet with the staff, the doctors. Also, if you get a chance, you want to meet with patients there on staff. So if they allow you to speak to any of the patients there, you want to have a conversation with them, but just get an understanding of the hospital, also the surrounding areas, and just get a firsthand experience of what your clients are going to experience when they travel to this overseas healthcare provider, and just make sure you're comfortable promoting them as a partner and as a hospital to your clients. And so site visits are the best way to vet overseas healthcare providers. And also, when you do a site visit, you want to make sure you take a site visit form with you. This is just a pre-made form that you can fill in while you're touring the hospital, just to make sure that when you go home, you have something to look at. And so you're not just relying on your memory. But this form it's already created for you. It outlines things like what's the nurse to patient ratio. You can mark that down, how many beds are in the hospital. And what you want to do is, while you're talking to the staff and while you're talking to the doctors, you want to just be filling out this document. Like I said, you don't want to rely on your memory. And when you fly home from this site visit, you want to make sure you have everything written down in real time. So site visits are the best way to vet the hospitals. But if you're dealing with a lot of hospitals, you may not be able to do site visits for every hospital in your network. So the second best thing you can do is vet them online. And you want to make sure that you vet their accreditations, vet their facility standards, as well as their patient care practices. And so when it comes to accreditations and certifications, a lot of times all you have to do is ask them what accreditations they have, and you can look it up online and verify with the certifying organization. So that's the vetting part. Now let's get into the contract. So your contract with the overseas hospital is going to outline a host of things, a range of things, but I'm just going to cover some key things. So one is, you want to outline what you expect from the overseas healthcare provider when you send them clients. So this is just outlining how you want your clients to be treated, the standard of care that you want your clients to receive once they arrive at the hospital. You can outline general things like you only want your patients working with licensed and accredited doctors and hospital staff. You can also let them know things like if there's a private room available, you want your clients to have access to that, and what things you would like to be in those private rooms. You can also let them know things like you want someone on staff who speaks your patient's native language when they arrive at the facility. Just so if your patients feel uncomfortable with something, or if they have any questions, they can communicate with someone in their native tongue. So you can just outline what you expect and what you would like your clients to have access to once they arrive at the facility. Also, this contract goes over your payment arrangement with the overseas healthcare provider. So you want to outline, how you'll be paid. So will you be paid a flat rate every time you send a client to them? Will you be paid commission? How will you be paid? Also, you want to go over how you'll collect payment. Will you collect payment 15 days after a patient arrives at their facility and the treatment is done? Will you collect payment 30 days after a client is sent to their hospital and receive treatment? Maybe it's 45 days, but you want to have that black and white in your contract, and you want to make sure you sign off on this as well as the hospital signs off on this. You don't want to leave anything to chance. You want to make sure you have everything in black and white. You also want to go over key things like, will you accept the payment from the client and then you pay the hospital? Or will the hospital accept the payment from the client and then they'll issue you payment? So you can do it either way. And there's no right or wrong way to do it, but you want to make sure that both parties agree to how the payment will work. So these are some key things that you want to outline in your agreement with the overseas healthcare provider. Like I said, guys, you want to make sure you don't leave anything to chance. This agreement should be very detailed, and we actually provide this contract along with all the rest of the contracts that you'll need to operate your company. But if you have any questions or you want to send me an email, I'm going to leave my email as well as a link to our contract packages below. But thank you guys for watching this video, and I'll see you in the next one.